about men versus women in terms of per capita drinking, and then you are wondering, but why this statistics comes out is that when you look at the gender-based violence in our country, and studies show that it is mostly perpetuated by men, and that's the same statistics. But also know that men are the ones who have access to income, they control income. That's a fact that we cannot deny. And that also tells you that actually, because most of the income is just taken for alcohol, because that's why they drink a lot. And that's the statistics. Then again, from the Honorable, who's almost my member of parliament, I pass his home when I'm going home. He said that...
Who is that?
Honorable Kugonza. I come from Kagadi, but initially I was with him in the same district, Chivali, so, and he's my neighbor. So, he did say that once you have money, then you're not food insecure. I want to refer you to Sustainable Development Goals 1 and 2. One is zero poverty, the other one is zero hunger. So you can fight, you have to fight both. It's not necessarily that when you have money, when you are not poor, you actually have food. So you have to fight.
Not all.
Okay.
And then I think that was a misquotation. That means, on one hand, people, when they transit and shift and they're looking at alternatives, they can be able to get money to be able to get food easily. And that, sometimes that happens.
But you have to fight both at the same time. Thank you so much.
Thank you so much, Chair. I'm responding to a comment that the health effects should be coming from maybe the illicit alcohol, not these other beers and so on. I want to inform this House that the harmful effect of alcohol is...
They said you're a doctor. Please give us more details.
To the Uganda Alcohol Industry Association and the part of coming from the alliance, I think we need to do a balancing act. I think both groups raise very fundamental issues. But the alliance team, even when we talk about the harmful effects of the alcohol, probably these are coming from a different type of alcohol the other people are not talking about. I will speak about even these statistics of World Health Organization about, I think they are not right. Because if you look at a district like mine and the neighboring districts, the kind of alcohol they consume is actually, yes, we have these other regulated ones, but this illicit alcohol is so much out there. And I don't think that it is, if all this is aggregated, I think the numbers, even the per capita consumption of Uganda would shoot up so much. And the figures, unfortunately, that you have given us, all the statistics are not as a result of your work. You are giving it from different, and I don't want to dispute them. But how I wish we had really our homegrown, home-captured statistics that you have been able to do, and have really been able to get down to those communities where they are consuming even the other kind of alcohols that the government does not know about. Because when they are processing they are packing them, nobody, because they don't want us to know, but they continue and you find them drunk. And these other health effects, I want to believe, are coming so much from that, not from these that are regulated. But now that we actually need revenue as a government, and also we need to kind of protect our people, I think we need to do a little more. And it's really a question of balancing, and I'm sure the committee will give justice to both presentations and come up with something that is pro-Uganda.
Thank you, Honorable. Honorable Enos.
Thank you, Chair. I apologize for coming late. My question is to the Industry Association. You fought the alcohol control bill. Now,
exactly. To say that all the clients, for example, that have been diagnosed with cancer, actually show that the reason is alcohol to a given percentage. This is what I want to understand.
Thank you, Chair.
Yes.
I was first responding to different questions. Now you pose another question that needs to be answered.
Uganda, among others. Together, we have been working tirelessly, advocating and promoting policies that ensure the enforcement of regulations on alcohol manufacturing, distribution, advertising, and consumption in Uganda. The Uganda Alcohol Policy Alliance, UAPA, respectively submits the following recommendations and observations to the Parliamentary Committee on Finance regarding the Excise Duty Amendment Bill 2025-2026. Our submission is informed by over a decade of evidence-based advocacy and collaboration with health, education, trade, and internal affairs ministries, as well as the national research institutions and civil society partners. We appreciate the Minister of Finance's commitment to leveraging tax policy as a tool for public health promotion and revenue generation. However, the current Excise Duty Amendment Bill requires stronger, more comprehensive provisions to address Uganda's growing alcohol-related burden. UAPA strongly supports the alcohol tax increment because it is a powerful tool for, 1, protecting underage persons by reducing access, preventing health, social, and economic harms through decreased consumption, and promoting national development by increasing productivity and generating the much-needed revenue after the donor cuts and public debt. Why Uganda alcohol tax policy must be reformed. Escalating alcohol policy consumption and related harm is one of those. Uganda ranks among the highest alcohol consuming countries in Africa, with a per capita pure alcohol consumption of 12.1 liters, double the average age of 6.3 liters, and significantly above the global average of 6.18 liters, that is as per WHO 2023. This figure is significantly higher than both the African regional average of 6.3 and also the global one. The report also highlights a gender disparity, with men consuming an average of 19.93 liters annually compared to 4.88 liters for women. Furthermore, 2025. Number 1, OI, unchanged tax percentage rate on beer, that is 30%. Maintaining the 30% tax rate on beer ignores growing public health concerns, undermines the WHO recommended alcohol control strategy, and weakens efforts to curb binge drinking. Number 2, exclusion of high alcohol beverages. The amendment omits stronger beverages, that is rum, gin, whiskey, wine, which contain higher ethanol content, are increasingly accessible to the youth, widen price disparities due to the unbalanced taxation. Number 3, illicit and informal alcohol market. Unregulated local, that is informal brews, remain untaxed, yet there is value addition nowadays, attracting a huge market, thus contributing to a public health crisis due to adulterated alcohol, significant tax revenue loss, a reinforcement of dangerous consumption patterns, illegal alcohol thrives due to weak enforcement and lack of coordination between agencies. Number 4, alcohol's impact on food security. Alcohol production diverts vital crops, that is sorghum, cassava, sugarcane, from food chains. Land conversion for the breweries, raw materials, reduce
Where are we going? Because
we are about to reach the recommendations.
no, I can see, but for example, on this point, I don't think as a committee we are picking your argument.